vaccine front today. The last 15 minutes, we told you how Moderna's phase 3 trials show the vaccine is 90% effective at providing immunity for at least 6 months. We know how long they're effective is one of your top questions. So I spoke with Dr. Jane Morgan from Piedmont Healthcare about that. She's a cardiologist and clinical director of the COVID task force at Piedmont. Dr. Morgan, didn't we almost expect immunity to maybe start to wear off at some point?
Well, that's unclear. So don't forget, we're under emergency use authorization, not FDA, which means that only 2 months of immunity data was required before we could release the vaccines to the public because we are in an emergency. So each month that goes by, we acquire another month of immunity data as we follow these patients out. So at this point, we probably have about 5 to 6 months of immunity data. Next month, we'll have 7 months. The month after that, we'll have 8 months. So we literally are all in this in real time. We have all the safety data, and we have all the efficacy data. We do not have complete immunity data because that would mean we would need to have waited another 1 or 2 years for approval of these vaccines, and that would not have been possible within a pandemic.
So let me ask you this then. Is this furthering the argument of, look, we're going to need to do this every year, get a booster, do whatever?
That's a possibility. We certainly don't have the answer to that as we continue to follow these patients out to 1 year. It's possible. Certainly, if we continue to lag behind in reaching herd immunity, we offer increasing chances for viruses to infect our bodies. We are the host to replicate, to develop mutations. And certainly, we can have mutations that would require Moderna, Pfizer, and Johnson & Johnson to go back and reformulate such that they can then provide vaccinations against the new mutations that were not circulating at the time of those clinical trials. So absolutely, time is certainly not on our side.
All right, Dr. Jane Morgan, Executive Director of the COVID Task Force at Piedmont Healthcare. Thank you.
Thank you.